In this training video, we will walk you through the process of inserting an IV catheter successfully. First, let's gather all of our materials. You will need an extension set, saline flush, an appropriate sized IV catheter, a long-term start kit, gloves, and a chucks. For pediatrics, you'll need an injection cap, an extension set, saline flush, an appropriate sized winged IV catheter, short-term start kit, 2x2 gauze, gloves, and a chucks. Be sure to consider size of catheter if giving blood or going for procedures that may require a larger IV.
Good morning, Miss Sweat. How are you?
Good. How are you?
I'm good. I'm Gail. I'm one of your nurses, and I've come to start the IV that your physician has ordered for you to get your fluids and your medications that you need. Okay? Okay. This is only going to take about 10 or 15 minutes. I'm going to look at your arm, assess your vessels, and then we'll go from there. Okay? Do you have any questions?
No.
Okay. Well, I'm going to wash my hands and then we'll get started. Okay. Okay, I'm going to slide this up under your arm. Now, Miss Sweat, I'm going to put this tourniquet on your arm and it'll be a little tight, okay?
Before inserting the catheter, make an attempt to locate veins that do not bifurcate. The vein should have good refill and a spongy-like feel.
Alright, I'm going to clean your arm. This will be cold.
After cleaning the arm with CHG, be sure to allow the skin to dry completely. When preparing the catheter, be sure to release the seal. Failure to release the seal may affect catheter advancement and proper needle retraction.
There's going to be a little stick. Ready?
Approach the vein slowly at a low angle. Apply traction to the skin to help stabilize vein and prevent rolling. Watch for blood return in the catheter, and when flash is seen, slightly advance to assure catheter is in the lumen of the vein. Insert catheter in the direction of venous flow back to the heart at a low 10 to 30 degree angle with bevel of the needle facing up. Lowering the catheter angle prevents posterior wall penetration. Release tourniquet and apply digital pressure beyond where the catheter lies to minimize blood flow from the catheter hub. Do not apply pressure over the catheter. This can damage the vessel and increase risk of blood exposure. After advancing catheter completely, depress the needle safety withdrawal button. Do not withdraw the needle prior to activation of safety button. Attach extension to hub of catheter and aspirate for blood return and flush appropriately. Apply dressing so the insertion site is within the window of the dressing and the blue stabilizers are securing the hub of the catheter and all connectors. Apply the tape strip under the extension catheter and secure to upper portion of the dressing. This is the two-handed technique of advancing the catheter. For pediatrics, apply tape in a winged fashion approached under the catheter hub. Apply tape across the top of the hub. Then apply a bio-occlusive dressing over the site. Apply folded 2x2 gauze under extension, set hub and secure with tape. Select an appropriate sized arm board if needed. All IVs must include date, time, initials, and gauge of needle. Do not forget to document the procedure in the patient's chart.
Now this IV can stay up to 4 days if you need it that long, but if you experience any pain, redness, or swelling, you be sure and let your nurse know, okay? Okay.
Thank you.
Okay, we're all done.
As you leave, make sure your patient's bed is in the lowest position and call bell within reach. Be sure to dispose of all trash and place the used needle in the sharps box.